Hi, my name is Noura. I'm going to be talking about our Capstone project. Math is the stressful reality of nursing school. We all felt the pressure of getting the 90% in second, third, fourth semester in our math exam so that we will be able to pass our clinical experience and move forward in nursing school. Also, we all understand how important math is in nursing school and nursing career because we all know that we need to have the right dosages of and calculations of medications for our patients. So the patient safety is first. My group and I also understand how important math is, how significant in our career and in nursing projects and in nursing practice, so that we will be able to be the competent nurses in the future. This has led us to move forward and choose the nursing standard of applying numeracy skills in nursing practice for our Capstone project. We tried so hard to work and find a way that will help our colleagues in helping our colleagues to find a resource that they can return to and relate to for their mathematical helps and numeracy skills. And because we understand how stressful mathematical exams in nursing school, we decided to create a blog that has many videos that the students and our colleagues can return to at any time for any mathematical helps. Casey, Shankar, and Navi now will be talking about our project, why we chose math, and how important math in nursing school, and so on.
Good.
Hi, my name is Navkiran, and as my friend Nora has already told you that we have selected this topic, how to apply the numeracy skill into nursing practice. So in order to complete our capstone project, we made a blog. In that blog, we updated and we uploaded the videos, which involves how to do the basic math calculation, how to calculate insulin, whether it's Humulin N or Humulin R. There were also some videos that shows how to calculate IV medication, oral medication, with a different kind of methods, whether it's a cross multiplication method or it's a mathematical formula based calculation. So for the videos, we also, under each video, we put questions, a single question, how to solve the question, and it was related to the video. And we also gave a chance to students to write their view about the videos. Even if they are not getting any question or they have any doubt, they can clearly ask us on that blog. And this was the main all about our project. We just created a blog, and we also posted a survey on the blog which shows how successful the survey our blog was. And this was all about the capstone project, our basic idea. And the main reason we selected this topic is today, in these days, medication errors are really common, not only for a nursing student, even for a nurse out in a hospital setting or in the healthcare field. So it's better to have a good grip on the mathematical skills, even in the numeracy skills. So our main focus was in order to just make students aware of medication errors and make their concepts in mathematical formulas really strong. So this was all about the topic, and we all really worked hard on this topic, and I hope everybody will just like it. Thank you.
Hi, my name is Shankar. I'm going to talk about the importance of numeracy in nursing. Like other nursing skills, the nurse should also should have the numeracy skills, and it is very obvious that the nurse should know about the mathematical formula and the numeracy skills while giving the drugs to the patients. and there are like a numeracy skills which the nurses generally use are ratios, proportions, and cross multiplications. And in terms of ratios, suppose if the doctor order is like a 5,000 units heparin, but the vial is 10,000 units per ml, then in this situation we have to do some kind of calculation to know how much drugs we have to administer to the patient. So for any kind of drug calculations we need numeracy skills. And the numeracy skills which we use is the system of measurement, which it means that there are numerous kind of systems of measurement such as gram, milligram, microgram, and at the same time kilogram and pound. So there will be some kind of doctor order where we see that like for example like 40 microgram per kg for any, especially for pediatric and geriatric patients. So in that situation we should know how to change the kg into pounds. If suppose the unit of weight is in pound and the doctor order is in kg, suppose like 40 microgram per kg, in that situation we have to change new pounds into the kg. Then again we have to do multiplication with the weight and the doses. So because of that, I mean, to figure out how much dose we have to give to the patient, we should know the multiplication or some basic kind of numeracy. Yeah, similarly, the nurses should also have some kind of knowledge of fractions, whole number, and decimal numbers. For example, if the nurse has to do any kind of IV administration without pump, in that case, when the nurse does any kind of calculation, the drop per minute may be like a 16.67. In that situation, the nurse should know which whole number is nearest to 16.67. Suppose the nurse should know that 17 is the nearest number for 16.67. So to understand this kind of basic kind of things, the nurse should know what is the what is the treatment of whole number, fractions, and what is the decimal numbers. And at the same time, as I talked about the IV medication, so if the nurse is going to administer IV medicine through the pump, then even at that time the nurse should be able to figure out what is the flow rate per hour. So in that situation, the nurse should also have to do some kind of calculation. So basically, the numeracy skills is important for the nursing. And apart from all those calculation kind of things, in some cases the nurse should understand the drug dosage protocol, such as like a heparin protocol and sliding scale insurance protocol. To understand those protocols also, the nurse should have basic numeracy skills.
Hi, my name is Casey, and I'm going to talk about why our group decided to do this topic for our Capstone project. So we decided to do nursing numeracy because we felt at one time or another many of us have struggled with nursing math, whether it's with the clinical tests or the test in foundations or the preceptor test. Some of us have failed or did not pass the requirements to go on. However, it is really important as a nursing student, and more importantly as a nurse out in the clinical setting, to always have proper drug dosage calculations. So we felt that it was a good idea to create a website that will be a resource to our fellow classmates to look to if they need extra help with math. As nurses, it is one of our most vital skills to know our nursing numeracy. In the clinical setting, there is really no room for error with drug dosages, and so it's important to keep up review of your math, whether you're in school or out in the setting, if you're a new nurse or even a veteran nurse. Nursing numeracy will always follow you in order to be a safe and competent nurse. Another important reason why we decided to do this topic is to stress the importance of proper drug calculations. 30 to 40% of medication errors are due to drug calculation errors. It is important that us as nurses keep up our competency in nursing numeracy. we decided to create a resource for our fellow students so that they are able to have something to back or have something to look into if they need.
You said this thing, you know. These all things you said already.
No.
In a
you know what
previous
you
video.
need to say, Casey? just the last thing.
Yeah.
That's why we decided to create the blog to help these students
To promote nursing
numeracy
skills.
and prevent these errors from occurring.
Help prevent drug
Errors, whatever, calculations.
Okay, let's go. It's on?
Yep.
Okay. Another reason why we decided to do nursing numeracy is to promote, How did I start it? How did I start
You were
it? I don't
so
even know how to say it
good. You were
anymore.
so good.
I don't even, okay, another reason why we decided to do.
To do this.
Otherwise, you can
No,
directly
no,
come.
it's to stress
You
the
can,
importance of drug
yeah, you can directly come saying that.
Gotcha.
Yeah.
Okay, last one I promise. Okay. Another reason why we decided to do this topic is to stress the importance of proper drug calculations. 30 to 40% of medication errors are due to incorrect drug dosage calculations. We decided to create this blog to create a resource for our students and to promote correct nursing numeracy skills. D equals your doctor's orders, H means what's available on hand, and V being your vector or your vehicle.
1 gram equal 1,000 milligram. And we have here 4 milligrams. 4 grams, sorry. We want to know how many milligrams. So we're going to do cross multiplication.
If your final concentration is 250,000 units per ml, you need to add 20 mLs of normal saline, just like the label says. For a final concentration of 500,000 units per ml, your concentration needs 10 milliliters of normal saline added to it. For a final concentration of 1 million units per ml, you need to add 5 mLs of normal saline.
The formula for the flow rate is ml. How much ml we are administering in 1 hour? That is the flow rate. So that's what for this purpose, what we do is the formula will be flow rate is equal to how much ml it is administered in 1 hour. And for in some calculations or in some problems, we will see not in we will see the time is given in minutes, not in hours. So for this purpose, we can also change this formula like ml into minute. If you change it into minute, you have to multiply by 60. Either this formula is also right, this one is also right. If you are in a problem, if you get the time as hour, you can use this one. It will be so easy. And if you are in a problem, if the time is given in minute, you can use this formula. So these two are the formula for IV flow rate. And after that, I will show how to do the calculations by using of this formula and by using this formula.
I'm just going to give a brief introduction of Humulin N. So Humulin N is usually twice a day, once before breakfast, and another one is after bedtime at HS and AC. And then I'm going to talk about Humulin N of Humulin R. Sorry about that. So Humulin R, it depends upon the doctor's order. It can be twice a day, which is BID. It can be thrice a day, which is TID. It can be 4 times a day, which is QID. So we have to measure the glucose level before giving this Humulin R to a patient. We as the nurses and students, we are confused with the bedtime. The bedtime is not 17:30, it's a dinner time. So we need to focus at this time, which is 21:30, that is considered to be the bedtime for a patient, not 17:30. So at 21:30, the blood glucose level was 6.7. At this point, as per doctor's order, I will give Humulin N to my patient, that is 12 units as per doctor's order. Right there, so it's 12 units at XS bedtime. And the Humulin R, as per sliding scale, will be 11 units. So we are giving total, a combination of Humulin N and R, 23 units.
So mathematical abilities and numeracy skills, it's a vital part in nursing career and nursing practice. It is important for nurses to feel confident and comfortable with their mathematical abilities so that they are able to provide a complete and safe care. Medication calculation is an important and vital skill that the nurses should do perfectly, as any other skills that we learn or we practice in our future career to prevent any costly mistakes. My group and I worked very hard to provide our colleagues with this help so that because we understand how important people's life is, and at the same time we understand that we need to show as practical nurses how competent and capable we are. My group and I hope that this project is a useful and a good tool for our colleagues that they can use at any time they feel that math something that they need help with. Thank you.